Health equity would mean to me social justice, that health is something that is accessible to all citizens and all humans.
By health inequities, what I think of is that people don't have an equal ability to have the resources that they need for their health. So sometimes that means that there are actually not physical services that are available, such as ability to access a clinic or a prenatal class, for instance, that may not be available to a particular group because they don't understand the language or they have some cultural differences. Unequal access, another piece of that is the issue of poverty creates an inequality that makes everything less accessible. So you may have the services, but if you haven't got the money to get a bus ticket to get you to the services, then you're also not able to access it. So we're looking at a kind of a passive inequality from the point of view of I haven't got anything, so therefore I can't make the effort. And the effort can also be an effort of self-esteem or an effort of confidence. There may be job openings available, but I don't even know how I can go to an interview. I think in public health or in community health, the issue of inequality is perhaps the most potent one, because it's in the community where we see how people really live. So health inequalities in a hospital setting are not as obvious. I mean, everyone gets the same care once they're in hospital.
We as nurses can support and help when it comes to health equity, or by one, ensuring that we follow practice standards. Number two, get involved in associations or groups that promote leadership. Yeah, so networking is a big thing, right? Mm-hmm. So learning to network and being fearless, right? And barriers do exist. Mm-hmm. It's up to us as individuals, as nurses, as advocates for ourselves, for our profession, and for the sake of our patients to make sense out of those barriers and try to undo them. Mm-hmm.
For leadership, what I would say is that every nurse to take on the responsibility of seeing what leadership means for themselves. Mm-hmm. So we typically think of leaders as being in a hierarchical position, with someone being the leader of others. I like to think of it more as an internal leadership. Mm-hmm. How and where in our lives can we take leadership? Maybe it is being a staff member and taking leadership around horizontal violence. Maybe for another, you can take leadership through education. Another person can take leadership through policy or politics. But for each person to look inside and really reflect, who am I? What are my gifts? What are my skills? And how can I show leadership in that?
How do you believe that we can, be inspired and get on board with this? Because some people are a little scared to go and talk to politicians or policymakers.
I think we have to overcome that. It's very important.
Yes.
We are doing it for a good cause, and as nurses we want to do good, right? It's for the good of the community.
Yeah.
For the good of ourselves as well, because we feel better.
Right.
And so I think we just have to lose that fear.
Right.
And open your eyes and see what's out there. Mm-hmm. And get mad.
Yeah.
I think that's a good way to do it.